Good evening. My name is Alan Whittington. Tonight I want to speak to you briefly about a healthcare policy that is part of the Affordable Care Act, which has impacted my life. First of all, the Affordable Care Act is a comprehensive healthcare reform law that was enacted in March of 2010. This reform was aimed at providing more Americans with healthcare coverage and lowering overall cost of healthcare. In October of 2012, Section 3025 of the ACA, Affordable Care Act, added Section 1886. This was an update to the Social Security Act, which established the Hospital Readmissions Reduction Program. The program required the Centers for Medicare and Medicaid Services, or CMS, to reduce payments to hospitals with excessive readmissions within 30 days, effective October 1st, 2012. These added provisions were implemented through Subpart 1 of 42, subsection 412.150 through subsection 412.154. In fiscal year 2015, the program added patients admitted for chronic obstructive pulmonary disease, or COPD, and for pneumonia. As a respiratory therapist and COPD educator for the Carolinas Hospital System in Marion, South Carolina, this has impacted how I provide care to my patient population, and this is why this is important to me. Obama and his staff also realized the problems that readmissions have in terms of cost and level of care provided to patients. Thus, this policy was developed to address just that. Now let's review some of the cons and the pros associated with this policy. As far as the cons go, large administrative fees and penalties being assessed to hospitals for these readmissions. There's also been a restructured payment plan that has now cut preventative services. So some of the services that we were allowed to use to care for our patients are no longer covered, and thus we can't use them. There's also non-compliant patients, which make it difficult for us to do our jobs. And there's bundle charges. So under the bundle charges, you get one payment for whatever admitting diagnosis. And so anything else that you do outside of that diagnosis, or anything that you do that's not covered, you do not get paid for. And this has put a strain on hospitals and staff. Now, as for the pros, the Affordable Care Act made it so that many more Americans have health care coverage. So the hope is that this will assist in offsetting the costs associated with the large administrative fees and the penalties that can be assessed for readmissions. The policy has also forced practitioners to engage more with their patients, not only in education, but also be aggressive in the therapies that we use in order to provide better care to keep them from being readmitted. A larger contribution of staff has also played a role. So we're using a multidisciplined methodology to see these patients' care from start to finish, and even after discharge, making sure that we're engaged in their care so that we can help prevent them from being readmitted. And finally, newly established protocols based on scientific evidence has assisted in taking care of these patients better. It gives us a tool to use which we know is effective, so that when we're using these protocols, we know we're delivering the best care possible. Despite the fact that I believe this healthcare reform needs a rework in some areas, it's definitely worth it to me to vote for it again in the future. I think that it forces practitioners to think outside the box and be more aggressive and use education more effectively in order to keep these patients from being readmitted. COPD patients are difficult to deal with in many ways. They get pneumonia, they get sick. A lot of these end-stage COPDers are very non-compliant, so this presents a lot of challenges. On top of that, 50% of these patients will be dead 10 years after finding out their diagnosis. So this is very eye-opening. So hopefully future research efforts and improvements in technology, along with these protocols and the staff being more aggressive and effective, will help lower some of these costs and make it easier to take care of these patients in the future. So thank you for listening.